Namaste. Very good evening to all. I am Dr. Sameer Chauhan, Manager Scientific Services from Himalaya Wellness Company. It's indeed a moment of immense pleasure to welcome all our beloved and respected doctors who are on board. On behalf of Himalaya Wellness Company, let me take this opportunity to extend my earnest greetings and regards to our today's guest speaker, Dr. Ravindra Sabnis sir, and all our beloved and respected doctors who have logged in. As you all know, doctors, this event is exclusive for the doctors of Gujarat and Maharashtra state. So once again, હું ડોક્ટર સમીર આપ સર્વે ડોક્ટર્સનું ઓનલાઈન ઇવેન્ટમાં હાર્દિક સ્વાગત કરું છું. मी ડોક્ટર સમીર आपण सर्वे डॉक्टरांचं हार्दिक स्वागत करतो. So before moving to the session, let all come together to light the lamp as a sign of keeping the flames of wellness and happiness alive. Thank you all the doctors. Doctors, as you all know about company, Himalaya Wellness Company, which is truly Indian company based at Bangalore, and the products are sold worldwide. We are working with the vision, wellness in every home and happiness in every heart, through our products validated by scientific studies and clinical trials. Through your constant support and patronage, we have successfully completed 91 years of trust and service in this field. And through this journey, we have been in constant connect with our beloved and respected doctors through the various means. As rightly said by Henry Ford, that the only medicine that keeps you young is learning. And as a part of learning, we have organized this event on occasion of World Kidney Day. Doctors, as you all know, that World Kidney Day is observed on 10th of March every year. And this World Kidney Day Joint Steering Committee has declared this 2022 year to be the year of kidney health for all, to spread the awareness about kidney health and diseases. This campaign is all about to increase the effort related to spread the awareness and education related to the kidney health. So through this, we have with us the eminent guest speaker, eminent personality and well-known urologist from MPUH Nadiad. So doctors, help me welcoming today's guest speaker, Dr. Ravindra Sabnis sir. Dr. Ravindra Sabnis sir is MBBS, MS, MCH Urology, Chairman and Head of the Department of Urology, Muljibai Desai Urological Hospital, Nadiad, Gujarat. Dr. Ravindra Sabnis sir has completed his MBBS, MS, and MCH Urology from LT Municipal Medical College, Sion, Mumbai. He is the Chairman and Head of the Department of Urology, Muljibai Desai Urological Hospital, Nadiad, Gujarat. He is the Honorary Secretary, Urological Society of India. He is the active member of various academic bodies like World Endourological Society, Society International Urologia, Urological Society of India, Indian Society of Organ Transplantation. He held various executive council posts like Treasurer, Mumbai Urology Society, Council Member of Urological Society of India. He is also the visiting professor in Urology Department, Hamad Medical Corporation, Doha, Qatar, Urology Department, BP Koirala Institute of Medical Science, Dharan, Nepal. He has also published his book, Urology Instrument Comprehensive Guide. His various articles have been published in national and international peer-reviewed journals and various platforms. Dr. Ravindra Sabnis sir. So doctors, stay tuned. Happy learning. Over to you, sir.
Well, thank you very much for this very kind introduction. And at the outset, I must thank you, your entire team of Himalaya Pharmaceuticals, for giving me this opportunity to talk to so many doctors at one go. I was a bit surprised nowadays since the COVID time started. Initially, there was a lot of enthusiasm of doctors logging in for the webinars and is, but over a period of time, that enthusiasm has really dried down. But I was really surprised when you told me that almost 2,000 doctors are registered and they will be logging in. So that's really creditable to your entire team for making so much of hard work. I must also appreciate, I was just going through your products and your whole background of your company, and it is really creditable that you are being following all the norms which have been set as a standard for making any drug research, good laboratory practice, good clinical practice, even the agricultural and other things. So that is, I think, the motto of your company, and that's the reason that your products have become so popular. In fact, I must say that we as a urologist, when we practice and we advise surgery and we advise all medications and various other things, people without knowing anything, they know Cystone when it comes to kidney stone. So that's a popularity, and that's a brand image which you have built up, and that's here your hard work of your entire team. And more than the hard work, the research protocol and all those strict scientific research which you follow, I think that has really helped you to gain the confidence in the minds of the people that yes, this is the product which is going to help them. So I must thank for once again for giving me this opportunity. And today I'm going to talk on the the topic which is actually close to everybody's heart. That's a medical management of the urinary stones. When it comes to urinary stone, moment you tell patient that you will need surgery, they are not happy. They will always ask that, can it be treated by medicines? Can it be treated by this? And of course, if the stones are bigger, there is no way you can avoid doing surgery. But even after doing surgery, the next question is that how do we prevent the stones? If stones are formed again, what next? Is it appropriate to undergo surgery again and again? Or are there any ways and means where the medication can be taken up and the prevention of the recurrence of the stone can be achieved? So these are all questions which are very, very common and very much concern for every person who has formed the stones. Either he has undergone medical treatment or he has undergone surgical treatment, or once the stone is formed in the family, everybody gets alert, and they also try to seek any advice as to how the stones formations can be prevented and what can be done. So this is a very common problem. This is a very common thing, and therefore I'm going to touch upon these aspects today in the in next 25 minutes or so, as to medical management of urinary stones. When we talk of medical management of a stone, what does it mean? There are two things, two aspects for this whole talk. Of various types. It can be calcium stone, it can be oxalate stones, it can be uric acid stone, triple phosphate. There are various types which are there, infective stones, so many types are there. So each specific type of stone has its own medical therapy which is available. That is a specific therapy for stones. And of course, then there are general dietary modifications for prevention of recurrence. So that is what we are going to touch upon. These two aspects we are going to touch. If you see in the evaluation, when we treat patients and start evaluating, if there is anything which is abnormal which is found out, when the patients come to us, we do thorough blood test, we do urine test, we do 24 hours urine test just to find out if there is any cause for the stone formation. And as you know, there are certain causes, specific causes which can be diagnosed So some patients have high uric acid level in the blood, so that is hyperuricemia. Some people have, if you see 24 hours urinary analysis, they have excessive excretion of oxalates in the urine. And that obviously, whatever you do, whatever dietary regime, whatever medical management you give, they are bound to form stones again and again. Some people have parathyroid adenoma, and therefore, whatever you do, they are going to have excessive calcium in the body, and then they are going to form the stones. So these are the specific investigations which we do. And if you find that there is some specific cause, then obviously that cause has to be treated appropriately. But in our experience of last 25, 30 years, when we see so many large number of patients with the stone, majority of the times when we do all the medical evaluation, blood tests, urine tests, all thorough checkup, majority of the times we don't find any abnormality, and therefore we blame that, okay, now this stone is a idiopathic, or there are certain environmental factors, the body habit, or whatever intrinsic factors which are responsible for the stone formation. And there comes the importance of the medical management of a urinary stones. So I'm going to discuss about that also today. So let us see, if you have a specific stones one by one, what can be done and what can be advised. Calcium stones, when you see this is the general tendency of the people, that moment they are diagnosed with a stone, people know that the stones means it's a calcium stones, and majority stones are all calcium stones. And often they know that calcium is very rich in milk products, and they themselves, without anybody's advice, without asking anybody, out of fear of formation of a stone again, or increasing in the size of a stone again, they will start reducing the milk and milk products. I have seen people who have stopped teas, who have stopped coffee, or stopped milk. Very difficult, but they do it because they are afraid that they will form the stones again. So that is what is the mindset which is developed, which is actually wrong. Now, if you see from the scientific point of view, the calcium intake should be in the moderate quantity. If you reduce the calcium in the diet, then that is actually counterproductive. Normal ideal calcium intake should be 1 gram per day. So that is considered as a normal. Whatever is your dietary regime, it should be evenly distributed, and that much should be consumed. If your calcium, if you cut down your calcium, milk products, everything you cut down, then what will happen is that because there is a low calcium in the diet, the oxalates will get absorbed from the intestine, whatever oxalate are there in the food. And if that oxalate is absorbed, then that is going to form from the stones again. So actually speaking, if you reduce the calcium, the chances of stone formations will actually increase. The other side effect of low calcium is that the bone density will go down. And as you all know, that bone density, if it goes down, there are so many hazards of bone density. So even if the person is having recurrent stones, recurrent calcium stones, the calcium in the diet should not be restricted too much. It is absolutely wrong to restrict calcium. In fact, the liberal intake of calcium to the tune of 1 gram per day is to be advised. So that is very important. Now, those who are having calcium oxalate stones, in fact, if you analyze the stones, if they pass the stones, or if you remove it by surgery, and if that stone shows calcium oxalate, either monohydrate or dihydrate, then they are actually to be given calcium tablet with the diet. What happens is that when the person takes a diet which has some element of oxalates, if you want to prevent those oxalate to be absorbed from the intestine, you must give calcium along with the diet. So what happens is that in intestine, oxalate and calcium gets united, and it forms the calcium oxalate salt. If calcium oxalate formed in the intestine, from the intestine, calcium oxalate can never get absorbed. Intestinal mucosa has no ability to absorb calcium oxalate crystal. If it is the oxalate in the other form, if it joins with some other atom, then it can get absorbed. And therefore, if you want oxalate to be prevented from absorption, you must give calcium so that the absorption doesn't take place and that calcium oxalate actually will will be passed out through the feces. When you want to supplement calcium, it is always good idea to have the calcium citrate as a tablet, which will be which is far better. Coming to the oxalate stones, 10% of the oxalate stones are due to dietary problem or the increase in the oxalate rich diet, whereas 90% of the problem of the oxalate stones are due to endogenous production of the oxalate, which is not in your hand. So what actually you can restrict by dietary intake is only 10% of the calcium oxalate stones. So oxalate, the other disadvantage or the problem of oxalate stones or oxalate in the blood or oxalate in the urine is that even if there is a marginal increase, there is a rapid precipitation of the calcium oxalate in the urine, and that will form very rapid formation of a stone. Or if the crystals are already formed in the urinary tract, then there is a rapid precipitation of more and more crystals, and it will form a bigger and bigger stone. So oxalate is very important rather than the calcium levels in the urine, and therefore oxalate has to be kept in appropriate control. So what are the foods which is rich in oxalate contents? These are spinach, cocoa, chocolate, nuts, tea. So if the people have excessive habit of drinking cocoa drinks or eating nuts or excessive tea, that has to be restricted, because that is going to cause problem. If you take say a rich oxalate diet, some people are habituated having chocolate and cocoa and ice cream and something like that. You cannot resist. No problem. You go ahead and take that. But at the same time, when you have the oxalate-rich food, when along with that, take one calcium tablet so that that oxalate which you have ingested through the diet actually gets absorbed or does not get absorbed. It forms the calcium oxalate crystal, and it is not going to get absorbed from the intestine. So that's a benefit. About 10 to 15% of the stones in our country are because of the high uric acid level, either in the blood or in the urine. So uric acid is high. So that is often from the excessive uric acid ingestion from the diet. Non-veg food is very rich in uric acid, and especially fish. Fish products, if you take in a large quantity, they are all rich in uric acid. And if you have excess uric acid in the blood level, obviously excess uric acid will be excreted in the urine, and excess uric acid in the urine will form the uric acid stones in the urinary tract. So that has to be restricted. Beer, wine, they are other examples of high uric acid of the diet. Acidic urine, if the pH of the urine is acidic, then that is another reason why uric acid will get crystallized. If you maintain the urine pH alkaline or neutral, to the large extent, precipitation of uric acid crystal in the urine is prevented. So this is a very simple measure. So what you need to do, or what you need to advise when we talk of a medical management of a stone, is one simple measure. If it is a uric acid stone, is to maintain the pH in the alkaline range or in the normal neutral range. Now, there are various medications which are available. Alkalinizers of the urine, those can be advised so that urine is maintained alkaline, and with that single measure, we have seen that patients have prevented uric acid formation. And sometimes even in the children, when they have high excessive uric acid level, we have seen that if you maintain the pH alkaline, the uric acid crystals or uric acid stones actually get dissolved. So that is the benefit of maintaining the alkaline pH, or at least to some extent a neutral pH. So check for the serum uric acid level. If the serum uric acid level is high, then obviously your medications, either Xyluric or febuxostat, these are all standard medications which are given for uric acid, high uric acid level in the body. So these are the some medical management measures which you can take for the specific uric acid stone. However, when there are stone formation, there are certain precautions have to be taken, which are general precautions, and those can be those can be taken by dietary modifications. If you see the non-veg food is very rich in various salts. And if a person who has stone formation, there is a study which is done in which they have found that a group of people who were strictly non-vegetarian, they had very high stone formation. So as the society is becoming more and more taking non-veg diet, these are the society, or these are the people who are likely to form stones. Why they form stones? Because in the non-veg diet, there is an increase in the excretion of the calcium oxalate. It decreases citrate in the urine. It makes a urine acidic, and therefore these are all factors which will precipitate the formation of various types of stones, and that is how the stones are increased in the number. So normal advice for the general precaution of a stone is to take 1 gram of protein per kg per day. So that is what is general advice. That is normal, and preferably this protein should be vegetarian protein, veg protein, or egg protein, which are considered to be the ideal protein content. Little bit part in the non-veg is perfectly okay, but a person who is, we have seen patients, or who have seen some people who from morning breakfast, lunch, dinner, they all consume non-vegetarian diet. And these are the sections, or these are the society people who have stone formation. So they have to restrict if they are forming stones again and again. The other important, when we talk of a medical management, I keep telling people that all the medications and whatever prescription we are giving will be futile if you do not take a adequate water intake. If you take the other flip part of that is that if you drink a lot of water, then whatever medications, even if you omit, it doesn't matter. So everything will get neutralized. So that much is the importance of the water intake. So often as a doctor, it is our duty to tell people, to tell our patients, to tell our relatives that drink a lot of water, whichever area you are in, whether you are in the dry area, whether you are in the hot area, whether you are in the cold area, whether you are in south, west, east, anywhere, the water intake has to be more. So there should be more than 3 liters of water intake. People who have tendency of formation of stone, they have to take some more water. It should be evenly distributed. What some people do, that they get up in the morning, drink 5-6 glasses of urine, consume 1 liter of 1.5 liters of quota, and again at the end of the day, or sometime in the middle, they will consume rest of the quota, and they say, okay, I finished my 3 liters of quota. But that's not right. It should be evenly distributed. What will happen is that in between period, when there is not much water intake, that's a crucial time. That is where the precipitation of the crystal will take place if there is not much diuresis happening, and that is counterproductive. That is not going to help. The other thing is that ideal pH of the urine should be maintained as a neutral. I will sometimes see that what are the problems of acidic, what are the problems of the alkaline pH. But if you maintain the intake, water intake large, automatically the urine pH will remain neutral. Other question which is there in the people's mind is that, doctor, I'm staying in the area where there is a lot of hard water. We have the bore well, and we drink only bore well water. Is that okay? Because that hard water is rich in calcium and other things. And how do we take? Do we take the mineral water? Do we have the RO plant put it into the in the home, or should we use some filters? These are all common questions in our mind. The scientific answer to that is that any water in any form is perfectly all right. There is no need to make too much of a fuss about the mineral water, about the RO water, and about the mineral free water. There is no need at all. In fact, it is counterproductive. Some minerals in the water is definitely necessary for the body to have all other normal functions. So my advice to all these patients is that any water, even if it is a bore well water, even if it is hard water, it does not matter. What is important is that excessive water intake in any form. The other important advice when we talk of a medical management is to advise the excessive or the good intake of the citrus food. What happens is that the citrus food is rich in citrate, and if you see the citrate, the capacity of the citrate is to prevent the stone. These are called as inhibitors of the stone. If you have excessive citrate excretion in the urine, then these are the things which will inhibit the formation of a stone. So that is very important role of the citrate. So if the patients are having calcium, whatever type of a stone, if you give citrate food or citrate medication, that is indirect prevention of a formation of a stone. So that is very important. So it's a good idea to have some orange juice, to have some lemon juice. In our country, if you see, if you go to villages, they always have the habit. If you go to remote villages in the dry area, whenever the guests come, they will first give lemon juice. I think these are our forefathers have thought of all that, and it is a habit that when they come, you give lemon juice as a drink, so that it not only gives the water intake, but it also gives a lemon through which you get the citrus, and that prevents the stone. Canned juice is actually not good because it has more preservatives, it has more sugar, is counterproductive, and therefore fresh fruits, fresh citrate fruits are far better. The other question which will come in everybody's mind, and as a doctor, all the patients will eat your mind, or in fact, before even they ask you, all these relatives would have told them that, okay, don't eat tomato, don't eat anything with brinjal or anything which has got seeds. That is where the advice comes to everybody's mind from relatives and other things. This is not correct, because to some extent, yes, it is all right, because tomato, it has got high oxalate, but at the same time, the tomato has a high citrate level also. So it is not only if you completely stop eating tomato, you are losing a very common and a very useful content of a citrate. So in a moderate quantity, any fruit or any vegetable which has got seeds is perfectly all right. Only thing, it should be consumed in a moderate quantity. Often people have are of the opinion that beer is excellent for the formation of a stone, or if the stones are formed, you drink excessive beer, so stone will be passed out. That's a very common notion which is there in the mind. Some people feel happy that, okay, now I have excuse to drink a lot of beer. Nobody is going to fight me. The parents are not going to quarrel with you because you are taking it as for the medicine. That is wrong. Beer has high oxalate content, which is extremely bad. Beer makes urine very acidic, which is again bad. It causes diuresis, which is good. And therefore, when you drink excessive beer, what actually it helps is that it produces a lot of urine. It causes a lot of diuresis. And whatever benefits of diuresis are there, that is what beer is going to give. Apart from that, it is not going to give any added benefit. And therefore, whether you drink beer or whether you drink excessive water, it has no relevance. It is almost the same. So there is no benefit of having excessive beer over and above the water. So that is what is the answer which you have to give if the patients they start asking that question. Often you will find that when you do 24 hours urinary evaluation, many times you will find that in the reports that they are hypositraturia. What does it mean? That their citrate level in the 24 hours urinary estimation is much less. That means because it has got an inhibitory capacity of the stones, if the citrate levels are decreased, even with normal excretion of calcium and oxalate and various salt, it will form the stones. And therefore, if you find such report, it is necessary that these patients should be supplemented with potassium citrate. And therefore, supplementation of potassium citrate and giving alkalinizers forms a very important part of the medical management of the urinary stones. Some people have hyperuricosuria. What does it mean? That excess amount of uric acid is excreted, uric acid crystals or uric acid is excreted in the urine. Now, this can happen even with the normal serum uric acid level or even with the high uric acid level. If you find simultaneously that serum uric acid level is high, then obviously you have to control that xyluric or fabulous as we saw that. But and the other thing, as we discussed some time back, is that in case if the serum uric acid is normal and 24 hours urine is showing excessive uric acid level, then you have to take all the non-specific measures like maintaining the pH alkaline, and that is very important, taking excessive water intake. What we generally advise when we give the medical management of for the stone disease is to advise them to check with the litmus. It is very easy. Everybody, they know what is the litmus paper and how it becomes acidic urine, alkaline urine, blue to red, and blue to red, and red to blue, and things like that. So what we advise is that let patient check with the litmus paper when they pass urine. So they have the idea whether it is acidic urine or it's a neutral urine or it's alkaline urine. If they think, if they find that the urine is acidic, then they can increase the dosage of the medications. You can give either the alkalinizers, or if they are non-hypertensive, or if there is no other problem, then the sodium bicarbonate is far better. Sodium bicarbonate will increase the pH alkaline without any problem and very fast. So soda bicarb tablet or sodamine tablets can be prescribed, and you can start with the low dose, that is 1 tablet 3 times a day. And over a period of time, depending on the pH of the urine, a patient actually himself or herself can increase the dose as he is titrating the pH of a urine by litmus paper. So that's a very easy method of achieving the alkaline or a neutral pH. Patient himself does. He doesn't have to visit you all the time. He doesn't have to go to laboratory to check the urine level. Simple measure, titration or dose. And once that dose is set, that with that, most of the samples of the urine are remaining alkaline or remaining neutral. That's a standard dose which can remain fixed, and then patient can continue to take that dose throughout the medication period. The other important stone is the infective stone, and the medical management of infective stone is extremely tedious. What is infective stones is that when there is an excessive infection, either because these are all infection of the urinary tract because of the urea splitting organisms. These are the Proteus, Klebsiella, Pseudomonas. These are urea splitting organisms. So what happens is that because of them, the urea in the urine gets splitted up, and that is how these stones are precipitated. These are also called as matrix stones, or these are also called as triple phosphate stone, calcium, phosphorus, magnesium phosphate stones. These are all infective slough-like stones precipitated because of the specific urinary tract infection because of the urea splitting organisms, Proteus or Klebsiella. So how do you prevent these stones, or if they are formed, how do you manage them? Now, they are typically when the urea is splitted up by these organisms into this triple phosphate or matrix stone. Typically, the pH of the urine becomes alkaline. So when I was telling you that the pH should be maintained alkaline, it has to be a balanced way. If there is a urinary tract infection, and if the urine is actually alkaline, you are quite sure that this infection is because of the urea splitting organism, then you can do culture. And if you find that these are the organisms, then these are the patients who should be aggressively treated. If they are not treated properly, if the infection is not coming under control, then these are the patients, eventually they will form the stones, and these stones are formed very rapidly. So it is very important to identify what organisms are there, what is the pH, and once you identify, then you can give the treatment accordingly. If you diagnose that these are the infective stones should be cleared very aggressively by doing surgery, whatever surgery you do, either PCNL or ureteroscopy or whatever you do. If you leave some stone back, then these are the patients who will have a very rapid recurrence. And therefore, if the stones are formed by whatever means, whichever surgery you want to do it, the complete clearance is mandatory. Sometimes these are the stones which are often not seen on the X-ray. They are very radiolucent stones. They can be diagnosed only on the CT scan. And therefore, just simple X-ray will not diagnose them. Ultrasonography or a CT scan needs to be done. And therefore, it is very important that these stones, once you are treating by surgical means, it should be completely treated. And once it is completely treated, the medical management has to continue. If you don't continue with the medical management, I'm quite sure, and we have seen this n number of times, that these are the patients within short time, they will come back with the same stones again, and patient will be very, very unhappy. So it is very important that culture specific appropriate antibiotic prophylaxis should be given for very long time. We give for almost 6 months or sometimes for a year or two, so that the infection is completely eradicated from the urinary tract. These organisms are not cause the infection again. The other thing is that medical expulsive therapy. This is the last slide where I am going to tell you about the medical expulsion therapy. What does it mean? That if the stones are formed, and often you will see that some patients, they are not aware that they have a stones, but when these patients, when these small stones, they come back into the ureter, that's a time where they get severe colic, and that is how they rush to the doctor. And in evaluation, you find that they have a small stone. If the stones are small, they all can be treated by medical management, which is called as medical expulsion therapy. So what is done in that therapy is that you give medication in such a way that these small stones, actually they are passed out. You facilitate them to be passed out. Now this can be done by two ways. One is that you increase the urinary output, so that excessive amount of urine production actually will build up the pressure in the urinary tract proximal to the to where the stone is impacted, and that pressure itself will push the stone downwards, and eventually it will be passed out in the urine. Along with that, once you have building up the pressure, the patients are going to get a little bit of a pain, and at the same time you want the relaxation of the muscles of the ureter. So that can be done by the antispasmodics. So when we talk of a medical expulsive therapy, the part and parcel is to increase the urine output and at the same time give antispasmodics, so that patient does not get pain, the relaxation of the ureteric muscle take place, and the stone expulsion is far better. Sometimes if they are continuous colic, you can always give some analgesics so that pain is relieved. Now, how to increase this urine output? There are two ways to do it. One is oral and one is rapid, that is by IV fluids. We almost always advise the oral medical expulsive therapy, because when patient takes the water over a period of continuously spread over the 24 hours, it has got far better benefit than suddenly giving some IV fluids and some Lasix or some diuretic and suddenly causing increase in the production over a short period. The disadvantage is that in a short period, if there is excess diuresis and if there is a stone which is impacted and if it does not move, then it will actually cause increase in the hydronephrosis, severe colic, and it may cause extravasation, it may cause rupture of the fornices. So that's a danger which can happen, and that should not happen. It can precipitate the acute obstruction, and that should not be recommended. So according to us, when you talk of a medical expulsive therapy, it is always good idea to give oral medications spread over a period of time, and we generally give 4 to 6 weeks so that they have adequate time for the stone to be passed out. Generally, by and large, the general principle is that if the stone size is 4 to 5 millimeters in the ureter, these are the patients in whom the medical expulsive therapy will have a good success rate. So to conclude, medical management of urinary stone is very important. majority of the stones, at least in our country and our region, are metabolically inactive, and therefore, rather than the specific treatment, the general treatment, general dietary control, general medical advice is very, very important. And plenty of fluid works much, much better than anything else. So that is what I wanted to tell about the medical management of urinary stones. Thank you very much. And over to Dr. Samir Chauhan, please. Thank you.
Thank you so much, sir. I would request you to kindly stop your screen sharing, sir.
Yeah, I have stopped. I have stopped sharing.
Once again, thank you so much, sir, for your knowledge sharing session. It was indeed the feast of knowledge, sir. It will definitely help to the practitioners. Whenever patient came with the myth, so how to counter it with the facts. So it will definitely be helpful to treat the urinary patients, sir. And I'm glad to announce that, sir, more than 500 doctors have already logged in, sir, and they are with us. So thank you so much, sir, for your valuable presence and all the doctors. So doctors, as you all know, that this online talk is brought to you by the makers, by Himalaya Wellness Company, the makers of Cystone 4, an exclusive formulation to manage the kidney stone. So I'm sure you have enjoyed thoroughly the session and you all are eager to interact with the speaker. Sir, we have already got many questions into the chat box. And I would also request all the doctors, if you have any questions, you can directly type into the chat box and we'll soon interact with the speaker. So before proceeding to the question and answer session, let me invite my colleague, Dr. Vaibhav Yokar, who is MD Ayurveda, Manager Scientific Services from Himalaya Wellness Company, to brief on the product Cystone 4. Dr. Vaibhav Yokar.
Dr. Samir, hope my screen is visible.
Yes, it's visible, doctor.
So thank you, Dr. Samir, for the kind introduction and the opportunity to present the said session here. Dear doctors, greetings from the Himalaya Wellness Company. We at Himalaya are serving humanity for more than 90 years with a vision in bringing wellness in every home, happiness in every heart. Doctors, on the occasion of World Kidney Day, Himalaya Wellness Company presented to you the online talk by Dr. Sabnis sir. Dr. Sabnis sir, in a very simple language, mentioned about the different aspects of medical management of urolithiasis. I hope you have enjoyed the session by Dr. Sabnis sir. Continuing the discussion, I, Dr. Vaibhav, would like to present how Himalaya Wellness Company is being the pioneer in the management of urolithiasis through plant-based medicine. So doctors, we have a lot of stone sculptures across the globe that gives us a sense of happiness each and every time we see it. They provide us with a visual treat and make us feel very good. But you will definitely come across some of the other stones which are capable enough to ruin the happiness and wellness out there. They can make one's life horrible, causing intense pain and discomfort. Yes, doctors, we are talking about urolithiasis. So doctors, today we are here to have a short discussion on the role of plant-based medicine in urolithiasis management. We from Himalaya Wellness Company started this journey by launching tablet Cystone in 1943 and syrup Cystone in 2008. We continued our quest to provide effective solution and we came up with tablet Cystone 4. Tablet Cystone 4 expels kidney stones and prevent recurrence. Tablet Cystone 4 contains extracts of extensively researched and time-tested botanicals. Tablet Cystone 4 offers holistic approach for the management of urolithiasis. It offers actions like anti-lithiatic, lithotriptic, anti-inflammatory, and diuretic. Now coming towards the actions of individual ingredients. Doctors, the first ingredient we are going to talk is Shila Pushpa D-diamocarpus pedicellata, which contains D-diamocarpol and D-diamocarpinol, which inhibits the calculogenesis, providing anti-lithiatic action. The hydroalcoholic extracts of Manjishtha, that is Rubia cordifolia, decreases the levels of calcium, oxalate, and phosphate levels in urine, which helps in dissolving oxalate stones. The extracts of Pashana Bheda, that is Saxifraga ligulata, contains bergenin, which shows potential effect on dissolving the mucin, which binds the stone particles and thus providing lithotriptic action. Nagarmusta, that is Cyprus caryopsis, and Vanatulsi, Ocimum basilicum, offers the anti-inflammatory activity, doctors. Apamarga, that is Acaranthus aspera, along with Gokshura tribulus terrestris, exhibits diuretic action by increasing the GFR. So doctors, once again, reiterating the actions of tablet Cystone Fort on urolithiasis, we can see that it corrects the crystallite-colloid imbalance, renormalizes urine pH, soothes inflamed tissue, preventing the implantation of the nucleus, and dissolves mucin, which binds the stone particles. So doctors, there are many papers which have been published in reputed journals across the globe depicting the safety and efficacy of Cystone. Presenting to you this important study published in Journal of Urology and Research showcasing the safety and efficacy of Cystone Fort in the management of urolithiasis. The conclusion of this study shows that there was complete expulsion of stones in 53% patients having stone size of 7 to 12 mm. The other patients who had a calculi of size 5 to 6.9 mm showcased complete expulsion in 57% individuals, whereas the other patients showcased significant reduction of calculi size. In the clinical parameters also, like colic pain, abdominal pain, which are very common in urolithiasis, Cystone Fort displayed statistically significant improvement, doctors. The other parameters like hematuria, nausea, vomiting, fever with chills, etc., were also reduced significantly. So doctors, this study concluded that Cystone Fort is safe and effective in the treatment of urolithiasis with significant improvement in clinical symptoms. There was no adverse effects observed during study duration and post-marketing surveillance study also. Now, there is another study in which safety and efficacy of Cystone Fort was compared with tamsulosin. This study was published in Medical and Surgical Urology. This study concluded that Cystone Fort tablet is having comparable results with the improvement of clinical parameters in urolithiasis and expulsion of kidney stones as compared to the tamsulosin group. Cystone Fort is having added advantages over here like anti-lithiatic activity, lithotriptic activity, etc. So doctors, coming towards the indication of tablet Cystone Fort, tablet Cystone Fort is recommended in urolithiasis for stones up to 12 mm and in crystalluria. Also, it is recommended to manage the post-lithotripsy complications. Talking about the dosages of tablet Cystone Fort, in urolithiasis for urinary stones up to 12 mm and crystalluria in adults and children above 12 years, you can recommend 2 tablets twice daily till the stones passes out or till the symptoms subside. In post-lithotripsy urolithiasis, you can recommend 2 tablets twice daily for 6 weeks. So doctors, thank you so much for your valuable time today. Now I hand over the session to Dr. Samir for further proceedings. Thank you, doctor.
Thank you so much, Dr. Vaibhav. Thank you so much, Dr. Vaibhav, once again for briefing on Cystone Fort. So now it's time for the question and answer session. So the session is open for question and answer. I would request all the doctors, if you have any questions, you can directly type into the chat box.
So there are some questions which have come
Yes,
up.
sir.
So I will keep answering one by one.
Yes, sir. Yes, sir.
First question is that can the Colic stone be eliminated? That is asked by Dr. Subodh Kale. The answer is that yes, the calcareous stone can be eliminated by the medical management of a stone. It all depends on which calyx the stone is. What happens is that when the stones are formed, if they are formed in the upper calyx as a rundal plaque in the peripheral part of the calyx, then gradually they are detached from the collecting tubules, and they are formed. They come into the calyx. If the water intake is more, then the advantage is of a gravity for the upper calyx stone. When patient is walking, people are walking around and then standing position, sitting position, upper calyx stone is a dependent calyx. So they can drop down from the upper calyx to the pelvis, and then from pelvis to ureter, from ureter to bladder, and like that. So that can be passed out. So chances of upper calyx stone coming out and getting eliminated are much more as compared to the lower calyx stone. Same size lower calyx stone, if you see the large study which are published, same size stone in upper calyx and middle calyx and lower calyx, chances of the stone getting eliminated in the upper calyx are very high, a little less in middle and very less in the lower calyx, because they have to come out with the anti-gravity, come into the pelvis, and then subsequently pass out in the ureter. And therefore, it all depends also on the size of the stone. So yes, the calyx stone can be eliminated, and that is how you can manage it. The other question is that...
Thank you so much, sir.
Yeah, go ahead.
Yes, sir. Thank you so much, sir, for answering the first question. We have other questions. The second one is, please suggest best pain reliever during the renal colic pain. And it was very quite common, quite question, we can say, from the practitioners. So I request you to answer.
So the answer is that any antispasmodic is good enough for the pain. See, there are two things. One is to give analgesic, which is to relieve the pain, any pain, whether it is a renal pain, whether it is a muscle pain, bone pain, anything. Analgesics is going to work. But in the colic, what happens is that the pain is because of the vigorous peristalsis which are happening. When the stone is impacted in the ureter, there is a peristalsis which take place. And because of the obstruction of the stone, the peristalsis movement is there is a obstruction to the passage of a urine, and therefore what body tries to do is that it tries to create the vigorous peristalsis, and this vigorous peristalsis against the obstruction will cause excessive pain. Now, if you somehow give a medication which will relieve this vigorous peristalsis, obviously the pain is going to go away. And therefore, the commonest or the simple medication is any antispasmodic. The simplest is the Buscopan, which is a cheaper medicine, which can be taken 2 or 3 times in a day. And it will give various, it will give a complete pain relief. The other medications which are tried, and there are many products which have come with combination of antispasmodic with analgesics and various permutation combinations. But eventually what you need is the antiperistaltic, antispasmodic. The other thing is that even if you relieve the pain, sometimes the colic doesn't disappear completely, because the pain component is so much that they get intense pain. In that case, you can add the analgesics. Generally, diclofenac gives a very dramatic relief. But one caution against the diclofenac is that excessive use of diclofenac can cause the renal damage, and therefore it should be prescribed with a great caution. Diclofenac patients get so much of relief that from next time they will not even ask you. They themselves will take that medication, and then they will come back with lots of unnecessary use of diclofenac, leading to all the problems and complications of renal damage. So that is what my answer is, that best thing is antispasmodic, and SOS if required, add any analgesic.
Thank you so much, sir. The next question is, okay, it's related to the Cystone, sir. So
that I
the
think
question
Dr.
is,
Vaibhav
yes,
can answer. And
Dr. Vaibhav, or even,
yeah, sure,
I would like
sure.
to answer. Yes, Dr. Vaibhav. The question is the role of Cystone in ureteric calculus.
Yeah, definitely. If we take a look at the the presentation that we discussed earlier, we could see how Cystone Fort is offering its advantages at various stages of the development of stone itself. It can provide relief even at the nucleation process also. The very nucleus which forms the core of the stone, Cystone Fort can help preventing the stone formation there at that stage. And even if there is a formation of stone, the mucin, the which binds the stone particles together, is being digested with the help of the contents of Cystone Fort. So yes, indeed, the stone is getting converted into gravels, and which can then be easily carried out through the urinary output. So yes, definitely they can be managed. Yeah.
Yes, Dr. Vaibhav, thank you so much.
I think it is important for
related to the
It is important for everybody to understand that when patient comes in, what they want is the relief from the stone, relief from pain, and the stone should pass out. Often we get patients that many people, as you know, when they come, they have already taken Cystone, or somebody has advised Cystone or something like that. Some people, they know somebody has advised homeopathic, and they ask that you are giving medication, can we take that? Because I think you have popularized the brand so much that they believe in more on Cystone than what we prescribe. So what we tell them is that you take that, you take this. What is important is the relief from stone. Whether you get from Cystone, whether you get from homeopathic, whether you get from XYZ drug, it is immaterial. What you are interested is pain relief and passage of stone. So you continue to take that. There are various ways, as Dr. Vaibhav in his lecture very elaborately told, that how the Cystone acts at various pathways, and that is where it acts. So every medicine or every pharmaceutical product has its own benefits, and therefore if you combine these medications, the benefit is added, and there is a possibility that the stone may be passed out in a faster way.
Indeed, sir. Thank you, sir. Thank you, sir, for your expert opinion. Thank you.
Thank you so much, sir. We have another question, sir. If the patient is like non-case of hypertension or diabetic mellitus, what do we do and how it will be managed, sir?
So with diabetes and hypertension, the management does not change. They have to be managed as like any other person, whether he has a diabetes or non-hypertensive. Only thing is that when the diabetes is there, when the hypertension is there are certain other restrictions which come in, like you want to have low sodium diet, you want to have sugar-free diet, you don't want too many fruits which contain the fructose and other sugars to be advocated. So your modifications in the diet has to be such that there's no point in advising to take excessive fruits, because fruits although you have benefits of citrus and other things, they also have sugar. So it is not appropriate to advise such thing. But otherwise, apart from the dietary restriction, the diabetes, the treatment remains same. All the medications have absolutely no contraindication from diabetes and hypertension point of view. Only precaution is that if you want to make the urine alkaline, then you tend to give more of alkalinizers rather than sodium bicarbonate or this, because they are on the restricted sodium salts.
Thank you so much, sir. Sir, I would like to take the last question, as it is related to this specifically this belt, Rajasthan, Gujarat, and Maharashtra. So one question came into the chat box that please guide us. What are the dietary measures to be followed for preventing recurrence of this urolithiasis, sir?
Yes, so I think this is the question which is there in everybody's mind, and the person who has asked has not only asked his question, but he has asked the minds of almost every person who visits the doctor, and every person who is in his family or he himself or herself has formed the stone, that what are the dietary measures. And the confusion adds when various relatives, they give their own advice, whether they are doctor, whether they are non-doctors, whatever, they give so much of advice that patient actually gets confused as to what to eat and what not to eat. I have seen few patients who was told that you restrict so much. I said, if you restrict all this, what are you going to have? Then it is as good as not having any diet only. because these are all lists which are coming out that all these restrictions has to be there. So my simple advice in that situation, especially we are in the Rajasthan and this belt where there is a hot environment, and as such the urine production is very less, that rather than a general advice, the most important advice is to take excessive water. If you take excessive water, all your dietary restriction eventually go away. I advise people that some people, they like chocolates, they like say so much that if you tell them that you stop this, after 3 months they come, so no, my lifestyle is all hampered, I am really uncomfortable, I can't stop this, I can't do that. So I said, okay, all right, you take this, but take in a moderate quantity, but you compensate that by taking excessive water intake. So my simple advice is to prevent recurrence is to take excessive water. Sometimes you feel that you are taking excessive water, but actually it is not excessive. You can measure it, and then you will realize that, hey, what I was considering excessive is only 2 liters of urine. Sometimes I tell the patient that, okay, you measure urine output. And if your output is more than 2 liters or 3 liters, then you decide how much intake you need to take to maintain that output. Eventually, what is important is the output. No point in measuring input. But if you maintain the output of 3 liters, in hot environment, what happens is that even if you take excess water, your output is very less because there is so much of perspiration, so much of loss is there. So in those situations, it is better to monitor output. Even in a peak of summer, your output should be more than 2 liters or 3 liters. Then definitely it will work effectively as stone prevention.
Thank you. Thank you so much, sir.
I think you're muted. Please unmute.
Am I audible?
Yes, yes.
Thank you so much, sir, for answering most of the questions. We have many questions, so I would request the doctors, if you have any questions, you can directly send these questions to us. We will definitely get back with the answers. As time constraint, it was at the we would like to conclude the session with a vote of thanks. So, as rightly said by William Arthur, that feeling gratitude and not expressing is like wrapping the present and not giving to it. So, on behalf of Himalaya Wellness Company, I would like to thank Dr. Ravindra Sabnis sir for his gracious presence and being the speaker of today's event. Thank you so much, sir, for your valuable knowledge sharing session, as well as answering most of the questions. Once again, thank you so much, sir. I would also like to thank all the doctors for your valuable presence, support, and patronage. I would also, on behalf of Team Scientific Services, I would like to thank all the Himalayans who joined the hands to organize this event. And at last, I would extend my deepest gratitude and appreciation to all those who have made this event successful. Once again, thank you so much. Jai Hind.
Thank you. It was my pleasure to join for this wonderful scientific meeting, and credit to all of you that you organized this, and I'm sure the audience must have been benefited. Thank you very much.
Thank you, sir. Thank you so much.
Bye-bye.
Bye.
ओके सर, तो मीटिंग बंद करूं? ओके, थैंक यू.
Congrats, Samir.
Thank you. Congratulations.